Well, hi everyone. It's 4 o'clock, so we'll get started. Thanks for joining us. This info session is about the Master of Healthcare Innovation degree, or the MHCI. The MHCI is now entering its sixth year, and it was the first fully online degree program at the University of Pennsylvania. And we'll learn more about it today. I'll get started by introducing myself. My name is Catherine Rodella. I'm the program manager of the Master of Healthcare Innovation. And most of my work is on the administrative side of the program, and a big chunk of my job is supporting students and making sure they get what they need to complete the degree successfully. So I'm the first point of contact for both applicants and students whenever they have questions about anything. And you'll also hear from my teammate Adam. Adam, would you like to introduce yourself?
Sure. My name is Adam Zolkover. I'm the Associate Director for Online Instructional Design. Primarily what I do here is I work with faculty to help them translate their expertise into excellent online courses.
Thanks. You'll hear more from Adam a little bit later. I just want to reiterate again, please stay muted and keep your video off until we get to that dedicated Q&A time at the end of the presentation. But if you have questions along the way as we go, feel free to type those questions in the chat if you don't want to save them until the end. The Master of Healthcare Innovation, or the MHCI as we call it, is a master's degree conferred by the University of Pennsylvania. It was designed from its very beginning to be an online program using effective online learning practices. So these were not existing in-person courses that were transferred to an online format. It has always been an online program. It's housed in the Department of Medical Ethics and Health Policy, which is in the Perelman School of Medicine at the University of Pennsylvania. And overall, the degree is designed to help you improve healthcare delivery and to adapt to the rapidly changing healthcare landscape. These are skills that we see more and more are essential for healthcare professionals, probably more today than they ever were. And the degree is meant to help you answer different questions about improving healthcare, things like how can you shape policy, or how do you influence patient and provider behavior? How do you identify inefficiency or test solutions through rapid iteration? And these are really important topics, but they're usually not covered in other degrees you might have, like, say, in medical school, nursing school, or in an MBA. So this is part of what sets the MHCI apart as a unique degree. So as a student in the MHCI, you'll do a few different things. First and foremost, you will definitely build a network. Your fellow students will become your resource network. Our students are healthcare professionals from a wide variety of different healthcare industries, so they really learn a lot from each other. You'll develop specialized skills for designing solutions to problems in healthcare. This is meant to be a very practical degree. You're going to get tools that you can immediately apply in your own work and skills that also inform the way you might approach future roles in healthcare. And you'll get to apply some of these new skills and concepts by practicing them in lab courses, so that by the end of the degree, you'll be fully equipped to implement an innovation project in the real world. And finally, you're going to create a portfolio. The courses throughout the degree will result in a deliverable, usually a project or paper, that you add to an innovation portfolio. And then this portfolio showcases your thinking, innovation, and leadership skills. You can use this portfolio, we hope, to gain support from stakeholders for different initiatives you want to get started, or maybe to showcase skills to a potential employer, for example. Obviously, from the name of the degree, you know it's a degree in innovation, but innovation can mean a lot of different things. In the context of this degree, when we say Master of Healthcare Innovation, we're talking about innovation as a methodology. So a way of identifying and solving problems in healthcare at all levels of the healthcare system. The degree focuses on two main competencies in innovation and leadership. So this particular combination of innovation and leadership is what distinguishes an MHCI degree from other degrees like, say, an MBA or an MHA, which would have a little bit of a different focus in their curriculum. Innovation skills that you would learn are things like idea generation and complex problem solving. Leadership skills you'll come across in the degree include communicating ideas to different audiences, networking, and persuasion. And this degree, just like the innovation field itself, is very interdisciplinary. A lot of our faculty come from the School of Medicine and the Department of Medical Ethics and Health Policy, where the degree is housed. But there are also faculty in the program from the Wharton School, Penn Law, the Penn Medicine Center for Healthcare Innovation, Penn Nursing, and the Penn Design School. And the faculty are all renowned experts in the degree's 5 main topic areas. These are health policy, behavioral economics, operations management, innovation methodologies, and health equity. These faculty members are all very active in their fields. They're influential decision makers and researchers in these fields at the national and international level. So you'll get access to their expertise, and you'll have the opportunity to interact with them in weekly live sessions. And it's this particular combination, again, of topics that the MHCI's curriculum focuses on that sets it apart from other degrees. So to dive into the logistics a little bit of the curriculum, this is a bird's eye view of what the curriculum looks like. The degree is designed to be taken part-time and designed to be completed in 20 months. But there is also a 3-year option available for anybody who might want to spread out the workload or spread out the financial commitment over a longer period of time. Either way, on the 20-month track or the 3-year track, you'd be taking the same exact courses, you'd have the same degree requirements. Obviously, they're just a little bit more spread out on the 3-year option. You can see each year kicks off with an event called the seminar. It's a virtual event, 4 days long, with orientation activities and social activities to get you ready for the school year. I'll talk more about that particular event in a little bit. And then throughout the school year, you're taking intensive online courses one at a time. Most of the courses are 6 weeks long. The final course in the program is 8 weeks, but all the other courses are 6 weeks long. And usually there's 1 week off in between courses on the 20-month track. On the 3-year track, you might sometimes have a little bit more of a break in between courses. And then in each of these 6-week-long courses, you can expect to spend around 12 to 15 hours per week on your schoolwork. You'll take 6 core courses that are marked in blue here, which will help you gain a foundation in healthcare innovation, and those focus on the 5 topics I just talked about. You'll get a chance to take 3 elective courses, which will let you choose from a selection of topics to choose topics that are relevant to your interests. And finally, you take 2 intensive lab courses that are required courses. And in these labs, you'll complete projects and assignments to practice applying concepts that you've learned in the core courses. And then in the final semester of the program, you see in that final spring semester an event in green called Innovation Weekend, which I'll explain more about in a moment. But just know that Innovation Weekend is an in-person event, and it focuses on networking and idea sharing and preparing you for life after the MHCI. I just want to pause there for a second and check and see if anybody has any questions about the curriculum so far. If you do, feel free to type your question in the chat. Does the program only start in the fall? Yes, it only starts in the fall semester of each year. Okay, I'll move on, but again, if you have any more questions, feel free to share them in the chat, or we can talk about them at the end in the Q&A session.
Before you move on, Catherine, Alana has a question. Are there scholarships available?
Oh, thanks. There are no scholarships available. I'll talk more about the specifics of payment and tuition in a little bit, but some students get tuition assistance from their employers. Some students can get financial aid through federal loans.
Jennifer asks, so when is the fall semester?
Oh, good question. The fall semester starts with the seminar at the very end of August. So if you apply now, you would be starting in late August of 2022, and then courses start at the beginning of September.
And Tandrilla asks, would you say that the program is suitable for professionals working 9 to 5?
Yeah, I would. The degree was designed specifically with full-time working professionals in mind. And when we get into more of the specifics of how the online courses work, we'll explain about how they're flexible but still structured enough to help you keep up with everything.
Thank you.
All right, thanks, Adam. Right here you can see a list of the courses. There are 6 required core courses, and they cover those 5 main topic areas that we talked about. There are also 2 required lab courses. And in these intensive lab courses, you'll gain a deeper understanding of the concepts from the core courses by getting a chance to practice them and apply those concepts. To give an example of what you'll be doing in labs, you'll design a pitch, a proposal, and a project charter for an innovation project. So the idea is that by the end of the degree, you'll be totally ready to hit the ground running and implement your project in the real world. And then you also take 3 electives, and you'll get to choose from the electives listed here to take something that's relevant to your interests and goals. And again, all these courses are taken in 6-week blocks, except for the final lab, which is 8 weeks. And you take 1 course at a time. While you're in the degree, you'll also attend 2 different types of student events. The first event is what we call seminar. It's a virtual 4-day event, and it kicks off the school year every year in late August. It's required for all students to attend every year. So if you're on the 20-month track, you'll attend twice. If you're on the 3-year track, you'll attend 3 times. And it's a really great chance to get to know your classmates and faculty members. There are a lot of social and networking sessions, orientation sessions, so you can practice learning the online tools before you have to actually start taking the courses online. And there are also interactive workshop activities and expert interviews, so you can start learning about innovation to get ready for the school year. And then in your final year of the program, in the final semester, you'll have the opportunity to attend a 2-day in-person event, the Innovation Weekend, which will be on Penn's campus in Philadelphia. And the goal of this event is to start getting you ready for life after the MHCI. So the focus will be on networking and idea sharing and feedback. You'll also have the opportunity to meet alumni at this event who are invited back for the 2nd day. And of course, I just have to say, any plans for our in-person events are subject to changes depending on what the public health measures are at the time. But as of now, we expect Innovation Weekend to be in person. A question from the chat from Jennifer. To be clear, we can't start this program until next August. That's right. Yeah, the next time a chance to matriculate into the degree is August of 2022. At the end of this session, I'll talk a little bit more about a certificate option that's available that you might be interested in if you wanted to start something earlier than that. Any questions about these student events?
Mihir asks, are all the online courses live or pre-recorded? If live, what time?
So Adam will tell you a lot more about the specifics of the courses, but to give you a general idea, most of the content is available on demand in the course, so you can access that content at any time. But there are typically once a week live sessions that are scheduled at a specific time. Those live sessions are recorded, so if you can't make it to the live session, you can still watch the recording. And the time varies depending on the course. But I think a lot of them do end up being in the afternoons Eastern time.
Christiana asks, when is the deadline for applying?
The early access deadline is February 15th, and there's a final deadline at May 1st, and I'll tell you more about the specifics of the 2 different deadlines later. But just know that if you apply for the earlier deadline of February 15th, you'll get your decision sooner. You'll get your decision in March versus getting a decision at the end of May.
Someone with the handle Penn Medicine asks, what kind of jobs do you get after obtaining the degree?
There's really a wide variety. Our students come from a lot of different professional backgrounds in healthcare. We have students who are in clinical roles and non-clinical roles. On the non-clinical side, we see executives in healthcare systems and digital health startups, administrators, researchers, analysts, consultants. So different career paths are very specific and individualized to each student. But I can say over 50% of our alumni have advanced in their careers since starting the MHCI. And when we get to the end of the session in the Q&A, I can actually pull up a list of a few examples of some job titles that alumni have gotten since starting the degree.
And last question for now, is attending Innovation Weekend a requirement or optional?
It is a requirement, but if for some reason someone's unable to make it, we can talk about that and work something out. All right, thank you. Well, you just heard me say a little bit about how professionally diverse MHCI students are, but one thing they have in common is they're all mid-career healthcare professionals, and they're very passionate and have a shared goal of improving the way that healthcare is delivered. Right now, we have 97 students across 2 different cohorts. For the incoming cohort starting in fall of 2022, I expect it'll be around 45 to 50 students in that cohort, large enough for you to meet students with a lot of different perspectives, but it's still small enough for you to receive individual attention and support. Our students, on average, have about 13 years of professional experience, but there is a wide range there. We have students who are earlier in their career and have been working for maybe about 3 years, and we have students who have been in healthcare for a long time, over 25 years. And students come from all over the U.S. and abroad. You can see on the left-hand side examples of some of the different types of roles that students have, and on the right side, different sectors that they come from. And this is definitely not an exhaustive list of the types of healthcare professionals who could be a good fit for this degree. And sometimes I do hear from applicants who aren't working specifically in healthcare right now and want to know if they can still apply. If your experience is outside of healthcare but related to healthcare, you can definitely still apply. I would encourage you in your application in the personal statement to explain how your experience, your professional experience, could translate into an impactful career in healthcare. There are a few different reasons why students choose to do this program. Like I said, they're all passionate people who want to improve healthcare delivery, but be a little more specific, some students are looking to improve the work that they do in their current role. Sometimes we get students who have just taken on a new role, maybe a more leadership role. So they want to make sure they have skills that they need to succeed in that new role. And other students aspire to a more leadership role in the future and hope the degree will make them more attractive to hiring managers. So I see a question in the chat. What is the average class size of the MHCI year over year? I like the current cohort that just started this past fall is 45 students, and we expect the incoming cohort that'll start this next fall will be around the same 45 to 50 students. If the applicant's final transcript is released mid-May, would the application committee wait for the transcript? We could talk about that. Send me an email individually, and we might be able to work something out. If you can at least provide an unofficial transcript in the meantime, I think that would be okay. I see a question, how may this degree differ from a Master in Healthcare Administration or similar degrees? MHAs probably will be more, obviously they'll be more administrative focused. So all the students in that program either work in or are going to work in administration in the healthcare system, whereas the Master of Healthcare Innovation is meant for a more diverse student body and focuses more on innovation and leadership skills. I think at an MHA you'll get some of those leadership skills, but not specifically the innovation skills that I talked about. Thank you. Good question so far. All right, I'm very happy that two MHCI, a student and alum, can come talk with us today to share with you a little bit about their experience in the program. Hannah Burns is a clinical nurse for UC San Francisco. She's in her final year of the program, will be graduating this coming May. And Eric Bassett is a senior partner at Mercer Health and just graduated this past May, so is a very recent alum. So if I could ask Hannah and Eric, feel free to come on your video and unmute yourselves, and I'll ask you a few questions.
Hey.
Hi. So first, Hannah, would you just mind quickly introducing yourself? Anything else you want to say about the work that you do now?
Totally. So like Catherine said, I'm in my final year of the MHCI program. I graduate in May, which I'm very excited about. I'm based in San Francisco. I've been an emergency nurse for about 10 years now, and I've always known I wanted to get my master's. I just didn't know exactly what I wanted to do. And I just knew I wanted a very broad degree. I didn't want to become a nurse practitioner or clinical nurse specialist. So I just wanted something broad and interdisciplinary. I ended up finding this program kind of by happenstance, working a night shift actually. And the classes spoke to me, the breadth of professors spoke to me, and it's just been a phenomenal experience, truly. So that's a little bit about me.
Yeah, thanks. Eric, you want to introduce yourself?
So Eric Bassett, I'm a senior partner in a consulting firm that focuses on the management, design, and financing of health plans and Medicaid. So we do both commercial work and government work. And I had been looking at sort of advanced degrees for quite a long time. Considered and even applied and was accepted into master's in public health programs and other things, but none of them seemed to really hit what I was looking for. And I had some responsibilities within the firm for innovation. And when I stumbled upon this, one of the department heads at Stanford University actually referred me to this. Which I thought was sort of interesting. When somebody refers you to a program at another institution, that tells you something very positive. And was very interested. And as previously mentioned, I immediately got a return. That's from the standpoint of things that I learned I began using in my work with clients and special projects as I was learning them. So it was a great experience for me, and I'm still using this now and actually have moved into some other roles where I'm focusing strictly on innovation within my firm. So it's been very positive.
Thanks, that's great. Love to hear it. One of the questions I get a lot is from people wondering how you can possibly manage this and a full-time job at the same time. And all, or at least most, the vast majority of our students are working full-time. So I'll start with Hannah, since you're currently in the thick of it in the degree right now. Can you share a little bit about how you manage, all of your coursework and all of the responsibilities outside of school that you have?
Yeah, in all honesty, it's been very manageable. What I really like about the program is each course is structured relatively the same. You have class about once a week for an hour. You have discussion. Every assignment is due Sunday. Unless there's a holiday, it'll maybe due Monday or Tuesday. So the consistency is very nice. So the last year and a half, I've dedicated just a few hours, probably 3 to 4 times a week, to continue the readings and complete the assignments. And it's been absolutely manageable. Even being on the West Coast, I have a class on the West Coast at around 9 a.m. when everyone else is at noon on the East Coast. So even it's nothing too early if you're on the West Coast. And assignments are due by 9 p.m. on Sundays on the West Coast as opposed to midnight on the East Coast. So it's been very manageable. And we use a Slack channel as well to communicate between cohorts. And that's been very helpful, just to text each other about assignments and everything.
Thanks. Eric, anything else you would want to add about managing?
No, I would, Anna, it was very manageable. It took me a little while to get into a routine. I'd sort of try to complete my classwork and my reading and viewing the class lectures and things like that during the weekdays. I travel a lot for my work, so I travel typically Monday through Thursday every week, and it I sort of got into a routine of completing those pieces, and then I'd spend the weekend typically working on assignments, which were mostly sort of written papers, research, things like that. So once I got into a rhythm, it was really much easier. And also, too, I think you mentioned this, Catherine, earlier, that you only take one class at a time. So that's nice as well. You can really focus in. You're not divided between so many things. So that pace worked. Also, too, I think, in the 21-month program, there were some people in my cohort who moved to the longer program. But for me personally, it was sort of great to have that focus and intensity for a defined length of time. And usually you can sort of accommodate, or at least I can, something like that. So if you like working in that way, it's a good fit.
Thanks. And Eric, I'll stick with you for this question because you mentioned it a little bit when you introduced yourself. Can you talk a little bit about how what you've learned in the program has impacted your work?
Yeah, I have responsibility at my work for developing a lot of the consulting content that we use in managing health plans. And I had developed a lot of that content sort of just from years of experience. And I didn't have a formal way of thinking through innovations in the space and how to develop those, how to sort of structure that process from contextual inquiry to sort of rapid testing and then sort of minimal viable product and then implementation and measurement. I sort of stumbled into those things. So I had no formal education around it. And so the greatest thing for me has been sort of using that content to actually sort of manage my day-to-day work at a much higher level and much more consistent. I think the other piece that I enjoyed immensely and has had great application is I've always in my work done a lot of research around behavioral economics, but I'd never had a formal class in behavioral economics. And of some of the classes in the program, those were some of my favorite. The health economics and behavioral economics have a direct application to some of the work that we do. And so getting a more formal base in that made a difference. And this is coming from, I'm 35 years into my career. So you would think, okay, he's an old guy, you can't teach him much new. And it was totally different. It was a lot of new learnings for me and a lot of things that had helped validate that I did before, but gave me a different way of thinking it or processing it or implementing things. So it's been wonderful.
Yeah, behavioral economics is one of the ones that I always hear from alums and students that they end up using a lot. Hannah, could you share a little bit? I know, you're still in the program, you haven't graduated yet, but have you been able to use anything you've learned in your work so far?
Yeah, absolutely. You kind of hit the ground running with this program, and being a bedside clinical nurse for the last many years, I am so patient focused. It's been really nice to use what I've learned in class and, like Eric said, the behavioral economics of it all to kind of expand and look at like where the holes are in the systems, how we can improve, what's feasible to improve now versus later, how to get, who are your stakeholders, who do you need to get buy-in from? And so I've definitely used it within my department pretty immediately.
Great, thanks. And then last question for both of you, Hannah, if you can start. So tell us a little bit about the cohort experience in the program and what kind of network that you've built so far.
Pretty immediately, I knew this was a phenomenal program right during our first virtual seminar. I've been so like hospital based. To expand beyond the hospital has been a truly unbelievable experience. There's lawyers, there's physicians, there's people who have worked at Etsy and Amazon in our program. And so some are clinical, some are absolutely not clinical. So getting and hearing all the different perspectives from people has really opened up my eyes to like, what can I do beyond the bedside? How can I take this? In terms of networking, I feel like pretty well connected with most of my cohort, even if they are on the East Coast. There's not many people on the West Coast, but still, I feel it was definitely a good program for networking. The Penn name, I'm also involved with like the Penn Alumni Association in the Bay Area, which has been kind of fun. Yeah.
Didn't a couple of you end up working in the same building, actually?
Yes. Yes. Another gentleman in my cohort works on the floor above me, and we're like the West Coast crew of our.
So funny. Eric, now that you've had a little bit of alumni experience, can you tell us a little bit about the network that you've built?
Yeah. I at first I was sort of worried there probably wouldn't be much contact because, like Hannah, I'm quite removed. I'm in Texas, not on the East Coast. But via several different organizations, everything from LinkedIn, there's a group of us that were in our cohort that are staying in touch via LinkedIn on a regular basis and support each other when we post stuff and documents and research and ideas and stuff like that. So that's been fun. And then in the broader Penn community, for instance, obviously in my work, I deal a lot in managed care. And so through this program, I was able to join the Wharton Managed Care Alumni Association. And there I'm getting a lot of contact, not necessarily with my cohort or other graduates from this specific program, but a broader set. So I've been really, really happy with the amount of keeping in touch with my cohort and then the new opportunities too that I didn't really expect to continue.
Awesome. Well, thank you so much, Hannah and Eric. I know you're probably insanely busy, so really appreciate you coming to share your experience. And if you can stay on till the end, we'll have some designated Q&A at the end, so maybe attendees will have a few questions for you guys too. But in the meantime, thank you. Go back to sharing my screen. And you just heard a little bit about the student experience from Hannah and Eric, and obviously a big part of the experience is the online learning experience. Like I had mentioned before, the classes are designed with full-time working professionals in mind. They're both flexible and on demand. So there are deadlines for assignments to help keep you on track, but all of the course content is available on demand so that you can access it and work on the assignments whenever your schedule allows. And then there are once a week live synchronous sessions with the instructor, but those are recorded also. So if you can't make that live session, you can still watch the recording afterwards. You should expect to spend around 12 to 15 hours a week working on the course while you're in one of those 6-week-long courses. And again, you'll be taking one course at a time so that you can really focus on that topic. In a course, you'll run into 3 types of content, and in a minute, Adam will actually show you what one of these courses looks like. But to give you an overview first, the 3 types of content you'll see are media, so things like engaging lecture videos by faculty and interviews with special guests. You'll get readings that provide context for the lectures and further resources. There are different types of interactions, weekly discussion threads to explore lecture content with other students, as well as those weekly live video conferencing sessions with the faculty members that I just mentioned. And there are also assessments, things like quizzes, assignments, and projects to help you apply what you're learning. And of course, Each course will have a final deliverable, a project or a paper that you'll add to your innovation portfolio. Okay, so now for the next couple of minutes, I'm going to hand it off to Adam, who's going to show you what one of our courses looks like on Canvas, which is the learning platform the MHCI uses.
Great, thank you. I'm going to share my screen right now. Can everybody see my Firefox, Catherine?
Yes.
Great. So what I wanted to show you is briefly the inside of one of our courses. So this is the American Healthcare System. It's the first course in the series. It's taught by Dr. Emanuel. And really what I wanted to concentrate on are three main things: that our courses are supported, that they're predictable, and that they're social by design. And I think you've heard a little bit about all of these things, but I really want to show you how this works in the course. So in terms of them being supported, what you can see here at the very top, the very first thing you see when you enter a course is contact information for the course team. So that includes the faculty member who's teaching the course assistants who are there to help you with content questions, and also a technical support email who can help you navigate Canvas. There's always a real human on the other side of the screen who's there to support you. The idea is that you should be able to concentrate on the content and not learning how to use the platform. And this is a step in that direction. The second thing that I wanted to show you, scrolling down the screen just a little bit, is the predictable part. You can see right here on the front page that all the due dates for the entire course are laid out right at the beginning. And you can put those in your calendar. You can download them as a calendar through Canvas and have those on hand. And not just that, but the basic pattern of work, so Sundays and things being due on Sundays and Tuesdays, is consistent pretty much entirely throughout the program. There are exceptions, and we'll let you know when those are. But for the most part, it's not just like 3 weeks from now that you can predict what's going to be going on in the program. It's like 3 months from now. And then the third thing that I wanted to show you is that our courses are social by design. And you can see here that every week has a discussion post and some discussion responses that are due. A lot of online programs have this, but I think that we do this particularly well, and it's a really good opportunity not just to learn from the course and learn from your classmates, but also to make those real connections. So just showing you the inside of a discussion, what you can see here is that there is a fairly elaborate prompt that you're asked to complete each week as you go through the program, and it's about practicing what you've learned. You're asked to respond to each other, and it's about giving feedback and teaching each other. But what this prompt doesn't really show you is that most times, most weeks, what you find is that those discussions go way beyond just one post and one response. And you learn about the professional circumstances of the people around you, and you also end up learning about the personal circumstances of the people around you. One of our students who was on the call had mentioned Slack. Our students in almost every cohort have found outside means to talk to each other, and discussions that start in the courses end up spilling over, and they spill over into extended discussions that we don't see, but that as a student you will. The last thing that I wanted to address, just very briefly, is the balance of synchronous and asynchronous interaction, because I know that somebody had asked that question. Every week there is between an hour and a half and an hour and 45 minutes of asynchronous material, so that includes lectures and interviews, like Catherine said, and this is an example of one of our lecture pages. And then there's usually 1 hour of synchronous time, that is interacting with each other and with the instructor through BlueJeans or sometimes through Zoom. Those are usually at noon or 4 p.m. Eastern. Sometimes they're at other times. We really encourage our students to make it, but they're also not required to make it. We also record those sessions so that if your schedule doesn't allow you to make it, you can also catch those at a later time. So that's pretty much what I wanted to show you about the inside of a course. Catherine, can I hand this back over to you now?
Yeah, thank you.
Great.
And
Thank you.
I want to re-emphasize what Adam said at the very beginning of his part, which is that the classes are flexible to fit all kinds of busy schedules. They're well supported. There's a team of actual humans here whose job is to help you succeed, and they're predictable. So you'll be able to plan ahead. They have a regular rhythm to them. I think Eric mentioned, once he got into the rhythm of how the courses work, it was a lot easier to know, what you're going to have to do each week. So before I move on, any questions about the online courses? So are the courses sequential? Some of them are. For example, and Adam, correct me if I'm wrong about any of this, since you know the course content a lot better. The labs are typically sequential with specific core courses. But if you had to miss one of these 6-week courses, like say due to a major life event, we definitely can work around that. All of our students are adults working full-time with family obligations. Stuff comes up all the time where I'm working individually with students to come up with new degree plans so that if they have to step away, they can, and it's okay. We figure out a way for them to finish up the degree. Okay, great. I know I get a lot of questions about the cost of the degree. The total projected cost, all tuition and fees included, is about $67,000. And that breaks down by course. So students at Penn pay their tuition each semester based on the number of credits they've registered for. Credits at Penn are called course units or CUs. So to give an example of what that equates to, one CU is roughly equivalent to a typical semester-long course, what you might call a 3 or 4 credit course at another school. The estimate for the coming academic year is that one CU, so one course, will cost $6,028, and students take 11 CUs total throughout the degree. These are the projected costs. The prices for the upcoming year aren't confirmed yet, but it should be close to this. In the table on the right, you can see how those credits, how the CUs break down on a term-by-term basis on the 20-month track. So it's pretty evenly spread out. Of course, on the 3-year track, it'll be even more spread out, and you would be taking 1 or 2 CUs per semester. And students pay for the degree in a few different ways. Somebody had asked earlier, and I had mentioned there aren't any scholarships available specifically from the program, but a lot of students are able to get tuition assistance from their employers. Students are also able to apply for financial aid through federal loans, and you can look for outside party scholarships. Some students have had luck that way. Before I wrap up and get to the Q&A, I do want to quickly mention also there are a couple of certificate options available from our department. One is a graduate certificate. In the graduate certificate, you can take 4 MHCI courses. If you take 4 within a 2-year maximum period, you can earn that certificate. And since they are MHCI courses in the graduate certificate, those credits can be transferred into the master's program if you were to apply to it later. There's also a professional development option. These are non-credit courses in different healthcare innovation topics, so they're not transferable into the degree, but they are a little bit of a lighter workload and shorter courses. So if you have any more questions about those, you can find out more on our website, improvinghealthcare.net, or I'm happy to answer questions about them later. The early access deadline to submit an application is February 15th, and we encourage you to apply by the February 15th deadline for a few different reasons. One, you'll get earlier access to exclusive MHCI content and different networking opportunities, and you'll also get your decision sooner. Be aware the MHCI does not do rolling admissions, so the admissions committee will start reviewing applications after that February 15 deadline. And you'll get your decision about 4 weeks after the deadline, so probably sometime in mid-March. If you can't apply that early, there is also a final application deadline of May 1st, in which case you'll get your decision sometime in late May. And to be eligible to apply, you have to have a bachelor's degree, and you need to have at least 3 years of professional experience in healthcare or in a related field. And you can apply by filling out our online application, which is available on the website, improvinghealthcare.net. In the online application form, you'll be asked to upload a personal statement, an up-to-date CV or resume, and contact information for 2 recommenders. Those recommenders will then get automated emails from us asking them to fill out a recommendation form for you. Outside of that online application, we also ask for official transcripts from previous schools you've attended. Please send electronic transcripts directly from the institution. And if for some reason your institution can only do paper transcripts, they don't do electronic, just reach out to me individually and we can work something out. There are no standardized tests required to apply, and there's no application fee. A question from Alexandria, would there be any disadvantage to applying at the final deadline, like the class being capped? No, the class would not be capped, so it wouldn't be a case of missing out on a spot. But the advantage of applying earlier is you can start getting access to content, start getting to know fellow students, and you get your admissions decision earlier, which is usually helpful for people in planning out their year and planning out finances. Okay, great. So that's the end of the formal presentation. Once again, that early access deadline is February 15, and we encourage you to apply by that deadline. But for the rest of the time, I'm happy to answer any of your questions. You can feel free to unmute yourselves if you'd like to ask it out loud, or if you want to put it in the chat, that works too.
Hi, Catherine. It's Scott Rashannon. I just have a question. If you complete the certificate program, and I saw that you can do that by taking 4 classes over the course of 2 years, and then you decide that this is something you want to, and I apologize the way, it's like midnight out here the way I look, so I'm sorry.
It's okay.
But then you decide to go into the full master's program. You think this is something I want to pursue, the full-on master's degree. Can you do that at that point?
Yeah, you can. And classes that you've taken in the graduate certificate can transfer into the master's degree. You know, if you apply and you're accepted into the master's degree, you can transfer those classes in.
Okay.
Yeah, we've had a few people do that before.
Is there a specific timeline then that you're under? It seems like this program is really set on its deadlines in terms of completion of the program. But if, let's say, you completed the certificate program and then you went into the master's program, would you still have the 20 months or 3 years to complete the rest of the coursework?
Yeah, so the timeline for the master's program doesn't start until you start the master's program. Yeah, the clock doesn't start ticking for that at the beginning of the certificate.
That's actually very helpful. Thank you.
No problem. Okay, I'm looking back. I know there are a few questions came in the chat, so I'll try to catch them. Can you give a Penn employee tuition benefits breakdown to get an accurate idea of how much it would cost for a Penn employee? Sure, I can give a little bit of a summary here, but a lot of it is very individual to the employee. So I'm also happy if any Penn employees want to contact me outside of the session, I can help put together an estimate for you. There are different tuition benefits for university employees versus Penn Health System employees. So university employees can expect to pay about 1/3 of the total cost of the degree out of pocket. For health system employees, it works a little differently, and it's much more dependent on the individual. So again, I'm happy to put together an estimate if there's any health system employees on the call who want to email me outside of the session, and we can talk about that.
From experience, I know we typically get, I think for most employees, it's $8,000 a year towards tuition.
Yeah, thanks. I know for full-time, it's $8,000 a year towards tuition, and the amount is a little bit different for part-time employees. And it's per calendar year, January to December. So just remember that each calendar year kind of straddles 2 academic years. So say if you're on the 20-month track, you could request that health system benefit 3 times because it crosses 3 calendar years. And then if you're on the 3-year track, you could request the health system benefit 4 times because it crosses 4 calendar years. Okay, what's the cost of the certificate program? For the graduate certificate, the program in which you take MHCI courses, the cost per course is the same as the MHCI because they're the same courses, so that's about $6,000 per course. Then there are professional development courses, non-credit courses in similar topics. The professional development courses are 4 weeks long and they're $1,000 each. I know a few of you had asked about career opportunities after the program, so I want to make sure to address that. So I have a list of some examples of job titles that students and alumni have gotten since being in the degree. Like I said, there's such a huge variety of different roles and career paths you could go into because it's a very interdisciplinary field, and our students come from all different kinds of sectors in healthcare, so their career paths will all look very different. But a few examples just to help give you an idea. We had one student who is a nurse and got a role as a bundled payment for care improvement navigator at their health system, helping advocate for patients. Another nurse who got a job as a partner manager of connected health operations and clinical transformation at a medical device company. One student who became CEO of a subsidiary of a major health insurance company. Another student who got a role as director of clinical adoption at a health analytics software company. So those are just a few examples. Again, the possibilities can be very different depending on what sector each student is in. But in general, I'll say, the degree I think would make you attractive to employers and hiring managers who are looking for people who have innovation and leadership skills. I know behavioral economics, like Eric had mentioned, is a pretty desirable skill set to have right now. So there are a lot of different things that you could do with it. And the degree will help connect you to all of your fellow students, the faculty, other program connections to help you figure out what path you want to take with it. Is this program eligible for GI Bill benefits? Yes, we've had a few veterans do the program before and they were able to use their benefits. Do the letters of recommendation have to be from different categories like previous professors and supervisors, or can they both be from your current position? Both from your current position is fine. We usually recommend that the recommenders be either supervisors or mentors who have worked with you closely, but you don't have to have one of each. If both are in that same category, that is fine. Is there an in-person graduation upon completion of the degree? Yes, there is, every May, except for 2020 and this year because of the pandemic. But typically, we have an in-person graduation ceremony on Penn's campus, and we all get together to celebrate. Does the degree have online on it? No, the actual diploma just says Master of Healthcare Innovation. It doesn't specify that it was an online versus an on-campus degree. And yes, graduates do have the same alumni status as other Penn graduates. Let's see, another question about the certificates. Could you dive deeper into distinguishing between the certificate programs and the MHCI? So I guess the difference between the courses in each. Like I said, in the graduate program, the graduate certificate, those are MHCI courses, so they're exactly the same as the courses in the degree. The professional development courses cover a lot of the same topics, but they don't dive quite as deep into the topics. And there are fewer assignments and less interaction in those courses. But they're also lighter time commitment and less financial commitment. So sometimes if somebody wants to learn the skills, but they don't want to commit to, say, a master's level course, that's a good way to start learning about the topics. Can you start the certificate course in January? Certificate courses run throughout the year, and you can start at any time during the year, so you don't have to wait for the fall to start a certificate. Isaac, are quizzes live during class time via webcam? No, quizzes are at a personal pace. So they're on demand on the course on Canvas. They'll have a deadline that you should do it by, but you do it on your own time.
Do you mind if I add on to that one, Catherine?
Yeah, definitely.
Isaac, I think it's possible that what you are asking is, do we use proctoring software? And the answer is no.
Oh, thanks. So Eric is answering. Someone had a question earlier about whether anyone has gone into the digital health space. And he says, yes, he definitely has cohort members in that space working for startups. And he's in that space himself. So some of the elective classes include digital health and connected client relationships. Thanks, Eric. From Saman, to clarify, university employees pay a third of the cost out of pocket, and health system Penn employees are able to get $8,000 3 times a year. Yes, in general, but I will say definitely talk to your HR rep and check, what exactly you're eligible for and what the exact amounts are. That's just a very broad summary that I wanted to give. Isaac, that's a good question. Who is this program not for? In general, I would say for somebody who has not been in healthcare at all and is looking for a way to get introduced to healthcare, this is probably not the right program for that. The classes and the assignments ask you to draw on your healthcare experience and to practice things. So it wouldn't be quite the right fit for that. And for the same reason, people who are coming maybe directly out of undergrad and don't have working experience yet wouldn't be quite the right fit. You're welcome, Isaac. And a question from Matthew. I'm definitely interested in the graduate certificate. If you start this spring, do you anticipate any curriculum changes to the MHCI that would complicate transferring those CUs down the road? I don't anticipate that there will be a problem transferring those courses down the road. Okay, great. Well, it's just after 5. Thank you everyone so much for all of your questions. And thanks so much for coming to this session. I'm going to put my email address in the chat again, just in case anybody else has questions that they'd like to ask outside of the session. And I'll read it out loud in case there's anybody who's on the phone. It's MEHP online, that's all one word, MEHP online at pennmedicine.upenn.edu. And contact me. I'm happy to answer any other questions you have. All right, good night. Thank you, everybody.